Yeah, so you're going to start shifting towards COVID-19 a bit now. So you're a part of a team that made a mask to detect COVID-19. So I'm really fascinated by this discovery. And yes, we talked about the paper-based diagnostics, but regarding the mask, can you first of all talk about how your mask can distinguish between COVID-19 and other coronaviruses? Because once again, this has been a big question lately regarding the accuracy of PCR testing for COVID-19.
Yeah, so our work on the face mask grew out of our recognition in the paper-based work, which really is broadly around cell-free, freeze-dried synthetic biology. And when Keith did the work that led to the paper-based diagnostics, he also uncovered that the ability to freeze-dry cell-free extracts and synthetic biology components were not limited to paper. They could actually function in any porous substrate, plastic, quartz, clothing. So prior to the pandemic, we were advancing an effort led by Peter Nigun and Louis Soeksen in my lab toward wearable synthetic biology. The idea you could spot cell-free extracts along with synthetic biology components onto patches or different elements of clothing to create a wearable diagnostic for healthcare workers, first responders, military personnel. And we're advancing efforts around, for example, the lab coat of the future that a doctor or physician's assistant could wear on his or her rounds to see if there's a pathogen on the loose in a hospital setting. In the face of the pandemic, we pivoted our efforts to see how we could address the pandemic and developed a face mask. It's specifically an insert that can be added to any face mask, and you'd wear it for 10 minutes or an hour, and it can collect the water vapor or water particles you give off, and if infected, those water droplets, elements, would contain viral particles that you could then detect, and we actually use CRISPR elements, CRISPR sensors, to detect whether or not there are viral particles there, and you can then program CRISPR specifically to target sequences that are specific to SARS-CoV-2, COVID-19, the bug underlying COVID-19, to differentiate it from other circulating coronaviruses and or other viruses like the seasonal flu. And we demonstrated this could work really well at very, very high sensitivity. So we could detect down to 500 viral particles, which only would take a few minutes to collect if you were infected.
Yeah, so I just want to ask, is this mask it has not been commercially released, right?
It has not been commercially released. So this is one of these academic pre-prototypes, but we are working at some level with Sherlock Biosciences, the company I mentioned earlier, to see how this can be advanced, and in discussions with a number of companies, both lateral flow assay developing companies and distribution companies that we hope we'll be able to partner with soon to advance this at minimum as a surveillance tool and possible research tool, and maybe as a prescription diagnostic.
Yeah, so I just want you to estimate the how much it would cost for the mask that could detect COVID-19 if it was commercially released.
Our target is to have it for just a few dollars.
Oh,
so
okay.
That we think that, and it would likely be sold either as a mask with the insert in, or the insert that you could be added to whatever your favorite mask is, but have it low cost so that it could be widely used in the U.S. and other countries, including low resource countries.
All right. Okay. So now we're going to move on to vaccines. So you say you're going to make a vaccine candidate for COVID-19. You're trying to repurpose the BCG vaccine. It was originally for tuberculosis to make it a coronavirus vaccine. So where do you see your repurposed BCG vaccine fitting in if it was commercially available along with the mRNA vaccines that are being made by Pfizer, BioNTech, and Moderna in the COVID-19 vaccine spectrum?
Yeah, so our early efforts at the pandemic was to see could we repurpose BCG by endowing with the ability to produce antigens associated with SARS-CoV-2 that then could trigger an immune response. And we were able to demonstrate that it could work very well to express these antigens on the surface and demonstrate it in vitro. As we advanced it toward animal work, Moderna and Pfizer took off very, very positively and amazingly and productively towards their mRNA vaccines. And so we did not push through some technical challenges on our mouse work and have tabled it for now. We do see that the BCG vaccine has great potential because it can be lyophilized, meaning freeze-dried, and thus very low cost, easy to transport, no need for refrigeration, and possibly could involve just a single shot. We are exploring how it might also be used orally as a delivery. Having said all that, it's also interesting to put in context that the mRNA technology that Moderna has developed actually has its origins in synthetic biology. So we were part of the team back in 2010, collaborated with Derek Rossi, one of the founders of Moderna, and George Daly, now Dean of Harvard Medical School, on developing and using synthetic mRNA as a way to reprogram and redifferentiate induced pluripotent, or to create induced pluripotent stem cells that can be redifferentiated. And this was the technology that led to the founding of Moderna. And we didn't focus on vaccines or therapeutics, but said it could be used in this regard, but actually focused on regenerative medicine. And it's so exciting to see that this technology was then further advanced by Moderna and then developed beautifully as a highly functioning.
Yeah, speaking of Dr. Rossi, I believe I told you in the email that I also interviewed him as well. So he did have his point of perspective on his mRNA vaccine. So we're starting to move on. There's some people out there and regarding adopting this new experimental mRNA technology. And once again, the US government has said about these people. So after mere months of testing, it's now being administered globally to billions of people. So how is it possible to know if there could be any unintended effects that could show up now and in the future? And can you share any of your main concerns?
You know, I don't have concerns on this vaccine. I think it's remarkable. I think it's been applied to a very large number of diverse folks. I think what we'll see is it expands into age groups in this country through trials, and then globally into larger populations and likely larger diverse populations. We'll need to keep an eye on potential adverse effects that might be linked with confounding factors, whether it's medications or genetic background or other conditions. It's been remarkably positive on what I've seen on very low side effects that are coming up. But you always need to keep an eye on that for any new development. My sense is these mRNA vaccines are remarkably safe and remarkably effective. It will be interesting to see what additional applications, indications they'll be applied to, and to what extent we'll get similar efficacy levels. Hopefully the answer is we will, but it's, we wait and see what will be the next indication that will come out of Moderna or Pfizer.
Yes. Drunk mistakes, we're bound to hit the ground.